Good morning and wish you all the best on this Doctor's Day. And I hope Dr. K.K. Agarwal would hold this Doctor's Day next year without this picture of Mr. Amir Khan looking at him. So, and you won't have to ask the question of how to revive the image of the medical profession. Well, it's a worry for you, but it's a greater worry for us because if there is a need for reviving the image of you all, then what happens to us, the patients? So we are a more worried lot. It's a very serious question, and I suppose the very thing that the question is being asked makes it doubly important to understand whether it is being, because this question presumes that there is a need to revive the image. But is there any need to revive the image? This is one of the questions which I'm going to ask the panelists who are both doctors and non-doctors. And most of the panelists here have lived abroad for years, so they have an experience of the doctors in UK, Europe, and America. So this is one question. And then the second thing is that there have been rumors, there have been mumbled conversations, whispered conversations for a long time that look, at the big hospitals that there are, they have to spend lots of money to maintain themselves. How do they do it? So do they neglect or do they try to exploit money? I heard a story in London about seven, 8 years ago that an English couple had come here for replacement of knee. You know, it's very, very expensive there, and if you go through NHS, the National Health Service, it takes years to get a doctor to do it. So this gentleman came here, everything was settled. Then the doctor told him that the second replacement can be done at half rate. This fellow got so panicky that he went back. And the right-wing papers there just took it up. So this was something which I think happened about 6 years ago. So there are problems, I suppose, but as you said, millions have seen this episode 4 where the doctors were discussed. One thing which we noticed was that doctors were never consulted. So this is a point which we will be discussing here as well. I have with me Pramod Sinha, who spent a lot of years in America. He is the founder, Dean of the Indian School of Business. He is also the founder, MD of the 9.9 Media Works Private Limited and a former partner of McKinsey Limited. Then I have with me Mr. Nipen Mishra, who was Secretary Telecom, Chairman of the Telecom Regulatory Authority of India. He's written some publications. He is very, very well versed in this side because he has been telling me about the doctors, family doctors especially. Then I have with me Ambassador Rajiv Dogra, who was also posted in London as minister. And as administrative head, he had to deal with a panel of doctors with the High Commission. Then he was ambassador in many countries in Europe, so he would know also about doctors. Then I have with me Mr. Arun Bhatnagar, another old hand. He has also been Secretary Government of India, Chairman Prasar Bharati. He was also posted in London for over 4 years. Then I have Priya Hingorani, advocate and an activist. I have advised him to go slow. So I suppose first I will ask Pramod, what has been, do you feel that in India there is a need to restore the image of the doctor?
Thank you first for inviting me here. I have to say that I am completely unqualified to participate in this debate. But let me first answer the question that you directly asked. Do we think that one can only answer these questions personally and directly, because for me to surmise what the general reputation is would be unfair. I think there are better people qualified to do that. But I have to say that having lived abroad for 12 years and my wife actually had a chronic health problem, part of the reason we actually moved back to India was because of the doctors here. So I have to say that I've had very, very unpleasant experiences with doctors abroad. I used to live both in Canada and the United States, and while I lived there was a lot of questions and continues to be about the different healthcare models in both those countries. And I have to tell you that I was actually in a situation where a doctor in Canada, who's a renowned specialist, my wife was in the emergency room in pain and he would not treat her. because we did not have the adequate insurance, and it was only because I had a different kind of job, and the regular insurance was not there. It was a slightly more complicated insurance scheme. So I actually took money out of my wallet and paid him in front of everybody for him to start treating her. And even after that, he made a hash of it, which is a different story. My wife was operated on, and later on we found out that the surgery was not required. The treatment that he gave was over the top. She was given some drugs and medication which were very strong and shouldn't have been given, and so on and so forth. So finally we gave up. And I have to say that the big thing that was missing was the personal touch. Now, I think we have been lucky to know people here and doctors here who help you out, but I must say that the personal touch that I have generally found with doctors in India is way beyond what you find abroad. And number two, I think the competence level is very, very high. Some people say that it comes from just treating many people, and so you get that much more experience. Whatever the reason is, my personal observation is that I would rather get treated by a doctor here than a doctor abroad. That's one thing. Let me just also say that I thought that I'm a big watcher of Amir Khan, and actually I watch all the programs. I think the songs are very nice. But I'm a media person, so I will tell you that some of it is clearly over the top. I know that the first incident that he showed in this particular episode, where he talks about that transplant, the kidney transplant, from what I know, it was actually the doctor took a decision and it didn't work out. I mean, that's the risk you're talking about. But I don't think it was a case of malpractice from what I know of that particular case. So I did a little bit of fact finding before I came today. So I called up my best friend in Patna, and he's a doctor there. He's very good. My family, my friends, everybody, anywhere in the world, they have a medical problem, they call him up in Patna, and they think he's an expert on everything. He's very, very good. So I asked him कि पटना में क्या होता है, with this. He said कि 90% of the doctors in Patna get anywhere between 30 to 50% commission from the diagnostic clinics. So that is a fact. Okay. At least that's what he believes. He also says that yes, the medical representatives pay people a lot of money. That they offer to put air conditioners, flat panel TVs. At least this is happening in a small place like Patna, which he's aware of. And equally, people from corporate hospitals in Delhi and so on offer commissions if you send doctors there. And so he says this is all happening. There's nothing hidden about that. Everybody knows that and so on. So I do think that this is a problem because it may be not a problem for a taxi driver, but I think that it is a problem in the medical profession because it does create a bit of a conflict of interest. I used to be a consultant all my life, and one of my good friends, Rajat Gupta, is caught in a insider trading issue. We used to be taught that you never trade in shares, and the reason you don't trade in shares is because the moment you own the stock of a company or advising somebody, then you start advising based on that. I mean, that's the principle behind it. So similarly here, I think the principle that anything that creates a conflict of interest in the profession that you serve creates a problem. So I think that I think is the biggest problem that is taking place. Does that mean all doctors are bad? I think one of the things that Anil Singh, my friend in Patna, said, which was very, I'll just take 2 more minutes, was that, listen, while this is true, it is also true that those 90% actually do proper treatment. It's not that they don't care about their patients, or they are trying to make some more money. Maybe it's on the side, but the fact is it's not like they are all fly-by-night doctors who are not interested in their patients. They are actually doing hard work. They are working long hours. If their patients are not doing well, they are concerned about them. And I think that is where my first point, that doctors here truly feel committed. You can rely on them. You can rely on their experience. I think there's a last point I want to make, and I just want to say that this is not a problem only with the medical profession. I think if I'm very involved in education, and you know what the reputation of educational institutions is. I'm recently involved in setting up a university in Haryana. It's a not-for-profit philanthropic initiative, and I tell you, I went through the process of getting the approval from the Haryana government. At each meeting, the people who were reviewing us would say कि नहीं ये not-for-profit मुझे बत बताइए कि पैसे तो आप बना ही रहे होंगे. you know. So it is assumed that you are making money. If you are in education, it is assumed कि आप पैसे बना रहे हो, ऊपर से बना रहे हो, capitation fee ले रहे हो, admission fee ले रहे हो, and all that. So there is, I do think there is a reputational issue, and I think that has to be solved. I don't know what the answer is, I'll let the others speak, but I just want to say that in all of these fields, whether it is media, where journalists are blamed for taking money to write articles, whether it is education, where educational institutions are accused of making money, our country continues to see these aspects, and I think the real problem is a question of supply and demand. Because there are fewer doctors, fewer clinics, fewer hospitals, these things tend to creep up, and it will happen in any society. That is my read from a management perspective. Wherever you have scarcity, wherever you have a mismatch in supply demand, this is what happens. If you had lots of doctors, lots of hospitals, lots of clinics, some of this will go away, right? Unless you systemically solve the problem. Mr. Kapil Sibal has been solving this IIT, JEE problem, you must have been reading. The main issue is we don't have enough educational institutions. That is why parents get stressed. You all know, those of you who have 90%ers in your class, in your of students, they can't get into a good institution. So same thing is happening in medical, and unless we actually expand the capacity in this country, you will continue to see these distortions and these behaviors. And I think that is what is the root cause of the problem. Can we solve it in the short term? I leave it for the experts.
Well, I agree with Pramod that the doctors here are certainly much better. They are human beings. The reason that I came back after 16 years from London is that my wife drove me that you have to get back to Delhi. We are getting on in age. If we fall sick, there is no Dr. K.K. Agarwal there. and in fact, after a diagnosis by a doctor in Harley Street, supposed to be God's gift to medical fraternity, I'll ring him up and say that this doctor has said this thing. Do I go ahead with it or I don't go ahead with it? So the trust in a doctor in India is far more than a trust in England, or I don't know about America, but in England you go to a GP and the GP is a friend also. When he comes to my house, he wants to know what drinks I have. But when I go to him, he would look at me and, yes, Mr. Dutt, what's wrong? And then I'll tell him, then he will just chalk out these number of tests you have to do. And then when I'm leaving, I said, Doctor, what do you suspect I have? You may have cancer, you may have TB, you may have pneumonia, anything possible. I will only tell you when the tests are done. I cannot see those tests from the lab. It has to go straight to the doctor, who will tell me then what's wrong with me. So this kind of, the bed manners are so bad that especially Indians who have been born with the doctor telling you, patting you, don't worry, don't eat too many chocolates, you'll get better. So with that kind of treatment, we are used to a different, like as Pramod said. About this 30%, I have my own take on that. You see, I had a family doctor in Lucknow, Dr. S.S. Mishra, who was FRCP in those days. He gave me medicines and he said, look, in this company, I have so many shares. So I said, Doctor Sahab, then he said, don't worry, I'm giving you the medicine because they are the best. I'm not giving it to you because I have shares in that. So if a doctor has some interest somewhere, but if he's giving you the right medicine, I don't think we should complain. After all, he is a human being, he also wants to earn money. About this 30% from the lab, I think a friend of mine is going to say that it is true. I have no idea. I have no idea at all because I have never had that. Most of the tests have been done either at Moolchand or in Artemis or somewhere, so I don't know what is done. Now let me also introduce the doctors. Dr. D.S. Rana, Dr. Yugal Mishra, Dr. Ved, Dr. Sanjeev Malik, and Dr. Neelam Mohan. They are very eminent doctors, very imposing. And Dr. Neelam is director, something in charge with liver transplant, which is a very high-sounding word. And doctor is the past president IMA. So I would like to ask you, Dr. Neelam, see, when you are with MedCity, such a big hospital, now the rich who go there, they expect the best out of you because they are rich and they are paying. What happens to the patients who are not that rich, but you look after them from your quota of looking after the poor ones? And then how do you satisfy those patients that they are getting as good a treatment as the rich ones?
Thank you very much. Well, to begin with, I would say that it's an extremely noble profession to be a doctor, because there is no doubt about it that it's a noble profession, and what we're talking about is some ethics that we have to look into it. Now, the question that you raised is it only meant for the rich? Well, it's not true, because when we see a patient, you are not actually bothered about whether the patient is going to pay you or not, because that is what I say is ethics. I mean, there is a patient who's sick. I may need to see that patient maybe 30 times in the same day, being into intensive care. And there may be a patient whom you just need to see once in a day. But doesn't mean that I'm going to charge the other patient 30 times in this patient one. So you have to, like a mother or like a parent, decide who needs more of your care at time and then give it. But yes, being in a center, which is the advantage of being in a huge hospital like Medicity, is that you have an amazing infrastructure. So you're able to provide not only the ABCD, but the XYZ of healthcare, which may not be available everywhere. And it doesn't mean that if I am into liver transplants, I would expect the government or anyone to spend, say, 15 lakh of rupees or 20 lakh of rupees to save a life, because at the government level, if they decide to judiciously use the money to save hundreds of lives for patients with malaria, TB, dengue, water contamination, they are justified. So but in India, health is mostly individualized, in the sense, if you come to me, it's only a small section who are insured, and most of them are paying for themselves. So you cannot decide, like in America, he talked about it, he didn't have the insurance, so nobody wants to see the patient. You go to NHS, I worked in England, and I truly say, if I have to fall ill or if I have to live, it would definitely be India. Because in England, what I noticed was, if you have an extreme sickness, they're very good for an extreme care. But if you have small little problems and mild, it's the worst place to live in, because the GPs and the reference, and that really delays the things and diagnosis and wait list, etc. So there are advantages, but what we talk about is there should not be, the ethics is very important when we are talking about. A doctor has to realize that the corporates should not take away the ethics. You should not have any targets left. You should be able to work in a comfortable atmosphere, and everybody wants to make money. But at the same time, this profession is something which you need to have. Every profession wants passion, but you need a lot of dedication and passion. I'm sure maybe somebody who works in a parlor may be earning twice as much as me, or somebody in a boutique. But I can't be compared. It's a profession where you get that dignity and you get that satisfaction. And when you lay down in bed, you feel comfortable, you saved a life. And isn't it the amazing advances in the medical care, the innovations that has happened in the diagnostics, the therapeutics, the surgical field? Haven't we ended up prolonging life, saving life, improving the quality of life? So there is no doubt it is a noble profession, and a lot is being done about it. But we need to ensure that we maintain that thing, that the money part should not be involved in treating anyone who deserves your care. Therefore, me as a person, I ensure that I spend 20% of my this thing into saving for the poor, whether it comes to the societies, the health camps, going to schools. Everybody should probably contribute to the society.